Scoliosis is very often diagnosed through initially a physical examination where the patient performs typically a bending test. And they do a bending test called Adam's test to see if there's any kind of rib differences or pelvic differences or to see any kind of spinal curvature that's occurring while the patient's bending. However, the entire posture should be assessed. Anytime we see postural asymmetry, we start considering, is there a possible scoliosis? And normally the next test that's recommended is typically a x-ray. And the x-ray is by far the standard of evaluation scoliosis. And we take an x-ray of the spine, normally looking at the entire spine from skull to pelvis and looking to see if there's any curvatures with rotation. And this is normally looking for any type of Cobb angles is the analysis to determine. If there is a diagnosis of scoliosis, that typically means the Cobb angle is at 10 degrees or greater, and there's normally associated rotation into the concavity of the scoliosis. And by far, the x-ray is the most common form of imaging that's used. However, MRIs, CTs can be used, but they're not as reliable and not as efficient as just a standard x-ray.